I wanted to update you on the knee replacement in room 12. He's managing stairs now, but still hesitant on weight bearing during turns.
That's expected around day 5. How's his balance, Mihira?
Improving, but slightly unsteady when pivoting. He keeps confusing his progress with the hip patient in room 14. They're on a similar schedule but different needs.
That can happen. I remember the hip patient also had an ankle sprain recently.
Exactly. She's avoiding load on that side, so not ideal to compare them. The knee patient's confidence is the main barrier now, not strength.
That's a key distinction. So are we still aiming for weekend discharge?
I'd recommend a short delay. If we push him too soon, he might regress. He's almost there, but pushing independence too early can backfire.
Fair enough. Mihira, let's give him another couple of days and reassess.
Agreed. I'll focus on more turning and balance tasks in tomorrow's session. I understand that dealing with this affected finger is both painful and worrying, Mihira, so let's approach its care with gentle, deliberate steps. The most important goal right now is to create a clean and protected environment for it to heal comfortably. Begin by gently washing the area with mild soap and warm water to prevent any infection from developing. A very soothing and effective way to do this is to soak the entire finger in a small bowl of warm, soapy water for a few minutes. This will help keep the area clean while also providing some relief from the discomfort. After you have gently patted the area dry with a clean cloth, apply a thin layer of over-the-counter antibiotic cream. This cream acts as an additional protective barrier against germs. Finally, cover the area completely with a sterile bandage or gauze, which will shield it from irritation and bacteria as you go about your day. It is equally important to be mindful of how you use your hand during this healing time. I know it can be difficult, but please try your best to avoid any activities that put direct pressure on that finger. This means being cautious when typing, writing, or even grasping objects. Putting pressure on the area is not only painful, but it can also disturb the delicate new skin that is trying to form, which will unfortunately delay the overall healing process. By giving your finger this space and protection, you are actively creating the best possible conditions for your body to mend itself. Remember to change the bandage daily, or more frequently if it becomes wet or dirty, and be patient with your body as it works to recover.